Hi everyone, this is Lakshmi, Pharmacist and Coach. I haven't posted any new videos for some time. I've been combining my pharmacy skills with the coaching skills so I can have the better holistic approach when I have to coach people. So, definitely, you are all going to like this approach rather than just the coaching alone. So, I hope you all welcome me back. Let me talk about my pharmacy experience. As a pharmacist, I've been practicing for almost 16 years. I started my career as a pharmacist in the long term care pharmacy, where we dispense the medication to nursing homes. And then I moved to retail store pharmacies, where I dispense the medications to communities. And as a retail pharmacist, I have the privilege to do not just dispensing the medications, but to do other things as well. I precepted the students from the Ann Arbor University, especially the fourth year students, and also I taught at the Wayne State University as a patient lab professor for the first year and the second year students. And I worked as a consultant pharmacist with the nursing homes, where as a pharmacist I have the privilege to check the patient's charts, checking on the drug interactions, checking on the disease interactions, and recommending to the doctors if it's needed, and also checking for the risk of fall medications and any duplicate of medications and inappropriate medications. I learned a lot from this consultation. And also I did work as MTM pharmacist, which is medication therapy management. This is the same as a consultant pharmacist, but you are individually checking at the patient, directly with the patient, interacting with the patient, and checking the same drug interactions, disease interactions, or food interactions, even recommending the immunizations depending on the age, depending on the health conditions they have. So I have privilege to work at the retail store, but learn a lot at the same time, do a lot to the community through my job. So definitely it's a privilege for me. As a coach, I train people on confidence, I train people on stress management, I train people on time management. Definitely can play a bigger role, especially these days, because everybody is under stress and you have to know how to manage your stress, how to calm down your anxiety and still progress your life and have better life and progress in your job. So definitely, as a pharmacist and as a coach, the holistic approach that I follow can benefit you more than any other coaching or any other coach they do individually. So as a pharmacist, let me give you the glimpse of some of the things. It's just a few of them. I cannot cover everything that we do, but I just bring the few important things because I'm talking about the interactions like drug interactions, drug disease interactions, drug food interactions. These can play a main role because you might be taking a lot of medications. Probably you end up going to the urgent care for some small problem, and you ended up probably going to the hospital or emergency because it became a severe issue for you. So let me give an example. For example, drug interactions, right? Drug interactions means one medication interfering with the other medication. Probably we all take a lot of medications. For example, you might be taking blood pressure medications, you might be taking the cholesterol medications, but some of the medications you cannot take them together. But let me explain one example. In this one, we take an example Bactrim DS, which is given for urinary tract infections, UTI, and warfarin, which is a blood thinner, which is can given for to prevent the clots, especially if you have DVT, deep venous thrombosis, or if you have the atrial fibrillation. This medication is commonly given. So, well, in this scenario, in this example, the patient has urinary problems and ended up going to the urgent care. Doctor asked her all her medication list, all her health conditions, but she forgot to tell about the warfarin that she been prescribed 4 weeks back, and she been taking the warfarin now, and she didn't mention to the doctor. And doctor checked her history and medications. He feels that there is no interaction with the medications and there is no health issues to take this medication. He prescribed her Bactrim DS, which she has to take twice a day. and she take the prescription and walk to the pharmacy, but she never filled the medication with the pharmacy either. She's completely new pharmacy because her pharmacy closed on that day since it's a weekend. So she comes to fill this medication. The pharmacist asks if you have any sulfur allergies or anything. She says no allergies, so she ruled out it's okay to take. And then before she get the medication, patient get the medication, pharmacist says like, yeah, you have to take with plenty of water, so it could help you to prevent the stones. And then yeah, so everything, pharmacist counsel, doctor asks everything, patient goes home, and she knows doctor asked her to take like morning and the evening. She started taking the medication as the doctor asked her, and same thing she is doing any other medication she been taking along with the warfarin too. So after 3-4 days later, she ended up at the hospital with the severe bleed. See, the severe bleed. What caused the severe bleed? Because she's taking the warfarin along with the Bactrim DS or Septrum DS for UTI problem. What it did, the Septrum DS decreases the breakdown of this warfarin. If it doesn't break down, the medication cannot eliminate from your body. It started accumulating in your body. And then what happens? The warfarin is the blood thinner. It causing the thinning of the blood, because the whole purpose is to prevent the clots. So it's thinning the blood. That's what it's doing here too. But it has more medication than it's needed in your blood. And it making thinner and thinner, and where it cannot clot anymore, and it started bleeding. The patient started bleeding. So that's what it's causing. The Septum DS interferes with the warfarin, breakdown of the warfarin, causing accumulation of the warfarin in your body, increasing the concentration of the warfarin in your body, which is lead to the thinning of your blood, which is leading to, again, bleeding. So, and you ended up with more severe complication than before at the hospital, or this time at the ER. So this is drug interaction. We want to pay attention when you're taking certain medication.